Hi, my name is Sarah McIntosh. I'm doing the video competency for the oropharyngeal and nasopharyngeal airways. I'm going to start with the oropharyngeal airway. The first thing I'm going to do is review the patient's chart and verify the doctor's orders. I will then gather my equipment. When going into the room, I will perform hand hygiene. The oropharyngeal airway is used on unconscious patients. So the first thing I'm going to do when I get into the room is verify the patient identity by checking their bracelet. I will then assess the patient's vital signs and assess them to make sure that this is the proper airway being used. I will position the patient by tilting their jaw up. I'm going to measure the airway by placing the top at the corner of the mouth and measuring to the angle of the jaw. I'm going to insert this sideways and then twist it to displace the tongue. If I have any issues with this, I can use a tongue depressor to help displace the tongue. I will then verify to make sure the placement is correct and that the airway is open, and then I will document this in the patient's chart. Next, I will be doing the nasopharyngeal airway. Again, first thing that I will do is review the patient's chart and verify doctor orders. I will then knock on the door because this patient will be conscious. Hi, my name is Sarah. I'm going to be your respiratory therapy student today. Can you please verify your name and date of birth? Thank you. The doctor has ordered for us to put a small tube in your nose to help you breathe. Is that all right?
Yeah.
Okay, and then I will perform hand hygiene. Gather all of my equipment. I will assess the patient to make sure that this is the proper airway being used and assess their vital signs. And then to measure, I will place it at the nostril and measure to the earlobe. When inserting this, I will lubricate the tube. That will glide in more easily. Then I want to insert this slowly into the nair. If I run into any resistance, I can twist slightly, which will help it go in smoothly. Once it is in, I will visualize to make sure that it is placed correctly. I can use a tongue depressor to move the tongue out of the way. And then I will again assess the patient's vitals and document this in the patient chart.